Once again, good morning, honorable members, ministers, and colleagues. My name is Masitole Zibeko, the secretary of the committee. Last week, we received a sick note from the chairperson indicating that once again he will not be available in today's meeting. Ministers and colleagues. So now, guided by the rules of the National Assembly, the Rule 139 of the committee on the day should have should identify a member to be the acting chairperson up until the chairperson comes back. Now, I wish at this stage to request members to nominate an acting chairperson for the meeting up until the chairperson comes back. Over to you, two members.
Masitole.
Honorable Kibi. Honorable Kibi.
Thank you, Masitole. Good morning, honorable members and ministers and deputy ministers. I nominate Honorable Lisoma to be the chairperson up until further notice. Thank you.
Thank you, Honorable Kibi.
Masitole, I can't raise my hands the other way. That's Ntuli. Masitole.
No, I know you, Honorable, not Honorable Ntuli.
Thank you. Chairman. Yes. Can I speak now?
Yes, Honorable Ntuli.
Yes, I rise up to second Honorable Kibi for the nomination of Comrade Honorable Lisoma as the chairperson of this committee till further notice.
Thank you, Honorable Ntuli. Honorable Lisoma has been nominated and seconded. Do we have any other nomination for the acting position? I always say silence is golden. Ms. Lesoma, do you accept the nomination?
Thank you, Masitole. I do until further notice.
Thank you so much. Thank you so much, Honorable Lesoma, and congratulations to you. Please take the meeting. I thank you.
Thank you very much, Masitole, and good morning, colleagues and DM and your delegation. The meeting is officially open. I quickly just start by appreciating the trust that you have put upon myself on behalf of the chair. Until he comes back, we'll continue to do our robust oversight as expected. An appreciation of being an acting chair. Masitole, we then need to look at the apologies. Have you received any apologies other than the chairperson's apology that has been recorded already?
We have an apology from Honorable Tebokulu, acting chair, and also from the ministry. I received a letter from the minister, Mr. Mtembu, apologizing as well. Those are the only two apologies that I have.
Thank you, honorable members. Those are the apologies with reasons. Are they accepted or adopted by the meeting? Accepted by the meeting? I get an indication.
Chair, Honorable Chair, can you hear me?
Honorable Schreiber.
Morning, Chair. I'd just like to request the reasons for the minister not being able to attend. What is the reasons that he indicated in that letter?
The reason in the letter is in the cabinet meeting that he has to be there. He would have loved to join us. So it's in writing, honorable member. With that, are we accepting the apologies, honorable members?
Honorable Chair.
Honorable Kibi.
Thank you, Honorable Chair. I move that we accept the apologies. Thank you, Chair.
Thank you, honorable member. Thank you, honorable members. That will brings us to the purpose of today's meeting, but there are few points that I would like to make, honorable members, that we are gathering. Welcome back from the recess, by the way, and I hope we had a very blossom oversight, as we expected also to do the oversight as well. But also, Honorable Maluman, it's Honorable Celesta. I know that we were on recess when you lost one of your loved ones. I would like, on behalf of the committee, again, to formally also record our sincere, heartfelt condolences for your loss, and you and your family find strength in the mighty Lord through this difficult time. But even for those ones who have lost their loved ones throughout the country and throughout the world, or because of the epidemic of COVID-19, we say the good Lord may shoulder them and look upon them favorable. And those ones who are sick to have a speedy recovery. And all of us ensure that we try our level best to have a healthy, safe living, as it were, and be compliant with the regulations of COVID-19. And of course, we are not out of the woods, although we are now at level 2, that most of the things are now starting to operate, and also for economic reasons, that we don't totally shut down our economy. But other members, I'm sure DM will respond to this and will take note of this, that I would like, on behalf of the committee, to register our pleasure of receiving the documents fairly late, which then disempowers members to ourselves as members to engage and cross-reference other issues and other statements, because you are aware that we receive a summarized version. We would have loved also to get the full comprehensive report so that we can cross-reference and be ready for the committee. And I'm sure DM and your delegation will take note of that one, that it doesn't repeat itself moving forward. And I'm sure you'll recall that we did say it before, sometime early this year, and it's happening for the second time. But also the point that in relation to the presentation and the program, that both departments were given the program, this quarter program, on time. We would also professionally, as supposed to be, that if the department feels that they will have some difficulties in terms of responding or favorable, also be ready for the item on the agenda, item scheduled for the day, would advise us on time, so that also we can have some time to also just to juggle around with the program. And of course, when we adopted the program before we go for recess, we said it's a working document, so we will really appreciate if the department also can be upfront to say we are not ready. Because even for the reasons that you stated, DM, I would say DM because you are representing the department, in terms of the performance agreement of the DGs, it doesn't hold water from where I'm seated, because the role of DPSA is to formulate policies, and DPME has to monitor thereof. The signing and the submission of the DG's performance agreement, and also within the provinces as well, should at any given time in a year, in March, not later in March, by end of March, they should have submitted that, which means that the systems are not old enough, because March now is 4 months down the line. So I just want to raise that one, that and I hope moving forward we will appreciate that. By law, it's more of a mandatory one that we committed ourselves as a government, or as the country, or as parliament, to say thou shall happen. We know that DPME supports the president in terms of facilitation thereof, which means there has been some realization of some sort in terms of ensuring that it monitors that. But also we observe that it might be because of the COVID-19 that has stabilized the forecast, because we have to also rework your plans and so forth. But I felt that on behalf of the committee, hopefully members will agree with me, I must just register that. And moving forward, we are expecting that we get the presentation 5 working days before the day, so that if there are anything that additional information that we require the department to be ready with, they could do that. With those remarks, honorable members and DM and your delegation, I will request that you tell us whether you are going to do the political. I'll request that you do the political overview, and then you identify among your team members whether it's the DG to make a presentation. I'll hand over to you. You will be presenting the COVID-19, as it were, observations, and also if there are any mitigating factors that you have employed and the challenges, and we'll take up from there, and the members collectively will engage on your presentation. Over to you, ma'am. Honorable DM.
Yes, morning. Thank you, Chair, and good morning to Portfolio Committee members, and also to greet the DG and the delegates from the Department of Planning, Monitoring and Evaluation. Am I audible?
Yes, you are.
I am. Thank you.
DM.
Yes. Thank you for the opening remarks. Let me just agree and concur with you that we will comply with the calendar which you have provided to us, and we will correct our mistakes of giving you the report late. We will ensure that we give it to you in 5 days' time, so that you can also be able to prepare yourself to read and also hold us accountable. We remain committed in doing that, and the DG is also committed to that. The DG and the team, they will go into details. I will just do an overview like you indicated. Portfolio committee members, we are going to be speaking on 2 items and other ones which you probably will ask and so forth. In relation to COVID-19, so we have termed the report a Q1 COVID-19 report because it starts from April until June. It's purely based on COVID, and it will serve as a baseline for future pandemics. What is happening is that in the report, it does not speak about MTSF. MTSF will be a separate item. In the report, we are communicating what is it that since the declaration of the pandemic, the lockdown, stage 5 until today, we're in stage 2. What is it that government has been doing to respond to the unforeseen and unplanned pandemic from the 26th of March? We will go into detail to speak about measures which government had introduced to assist in curbing the virus, but also to educate our people about what is it that they need to do, what is it that they don't need to do. The report will also speak in relation to various relief funds which various departments had put in place, and they are continuing to outroll them, and where are we? We are also going to be speaking about the MTS review roadmap. We call it a review roadmap because at the time when government opted to review the MTSF, maybe Chair, you can ask somebody who is speaking to maybe mute their mics.
Okay, honorable members and colleagues, kindly mute your mics and also switch off your videos if you may, your camera. Thank you.
Okay.
You may proceed, honorable DM.
Okay, thank you. The MTSF review, we call it a review because the projections which we had made in between the pandemic around June when we started the process, not June, around April when we started the process of reviewing the MTSF, we have come to realize that the pandemic is still very much with us, and therefore there is a need for us to review the MTSF. What we are bringing to the portfolio committee is information sharing and also to bring you along so that you are able to understand what is it that we are going to be doing. This review roadmap will still come back to Parliament for adoption and the portfolio committee. So we are just bringing you to speed in relation to what informs us wanting to do the review of the MTSF. One is because there are 3 drivers which were not necessarily included in relation to the 4th IR Commission. About 2 or 3 weeks ago, the President received a review or not necessarily a review, a report on the 4th IR Commission, and therefore that necessitates that even in relation to the MTSF, we have to infuse part of the key drivers which are in the 4th IR. The other one is the NDP review. At the time when we reviewed the MTSF, we had made certain projections. We are realizing that those projections also need to be reviewed because also the NDP has been reviewed and therefore it must find expression in the MTSF. The COVID economic recovery plan also needs to find expression. So those 3 are the main key drivers of the review of the MTSF. What we will do is that we will still take the report to cabinet. We'll also pass it through a cabinet lekgotla, and then it will still come back to the portfolio committee and eventually the entire parliament. So basically that is what they are going to. So I'm going to allow the DG to then go into details, and then after that we can interact in relations to questions which you might be having, so that we can be able to clarify you. Once again, I want to retaliate, Chair. We are committed to working with the portfolio committee. We are committed to ensuring that we provide you with reports on time. We also comply with the schedule that you have given us for this quarter, and we'll ensure that we do not fail you in that regard. Thank you. I'm going to request that the DG and the team, they take it from here.
Good morning, Chairperson, honorable members, and DM. Thanks for giving us this opportunity to present our reports. As the head of the administration in our establishment, I need to take a responsibility and commit to work with the Parliament, respond to the requirements of Parliament, especially when it comes to submitting information on time. So, Chairperson, I will not give any excuse, including the fact that I'm the newest member of the management team. I take full responsibility, and I will make sure that we submit all the required documents to you well on time. Now, Chair, I've just seen in the agenda that we will present first the COVID report, Q1 report, and then take discussions, and then go to the next report that deals with the review of the MTSF, as the DM has already indicated. Now, Chairperson, without much ado, the first report is going to be delivered by DDG Mahomo Chatsinde, supported by DDG Blake Lifatula. And once they are done, the next report is going to be presented by Acting DDG Lindsay Martin, in that order. And guided by the DM, we will then respond to all the questions that will be asked by honorable members. So with your permission, Chairperson and honorable members, let me ask the DDG, Chatsinde board. She has asked the Secretariat to project from her side because of some glitches. As honorable members will know that she had some fiscal, some health challenges. So she will take a lead in that regard, and then supported by DDG Lifatula. Over to you, DDG.
Thank you very much. From my side, there is a big echo. I don't know what is happening.
Probably, ma'am, is it not your TV on or next to the TV? You can switch it off the TV and request them to switch off.
On here with me.
Okay, no, that's fine. You may probably switch off here, but you can proceed.
Okay.
My name is
I'm the DDP responsible for monitoring, sector monitoring.
Sorry,
my
One second, Honorable. DPG, 1 second. 1 second. 1 second. Is it from you, the noise?
the presentation from my side.
we can't hear anything, Honorable Chair.
Yes.
No, DPG, 1 second. DPG.
Yes.
Yes, I just want to say that we can't hear a thing. Can you sort out the noise behind you, or find a better, or close the door?
Can she mute acting chair?
Yes. Can you do that?
Honorable Soma?
Yes, I'm listening, Master.
I've muted her on my side. Another possibility of the noise is when the delegation is sharing one office. So you'd find that one speaker is another corner, another person. So there's a bouncing of the audio. Maybe you can advise the DDG to also just try to move away. Thank you.
Okay. Unmute her. So, okay. I'm sure she heard you. DDG? Or DG, can you?
Yes, if I can intervene, Chairperson, I have another DDG. Chairperson, if I can intervene.
Yes, I'm listening to DG. Can you just check that so that she doesn't come in?
Let me mute her again.
Please mute her
Okay,
again.
please, Martin, and save time.
Chairperson, with your permission, if I can intervene.
Yes,
And ask DDG Blake Lifatula to present instead, because was also ready to compliment her. So let me ask DDG Lifatula to present going forward. DDG Lifatula.
And please advise her that you have replaced her. Thank you.
Yes, I'll call her on the other side.
Okay. Thank you. DDG Blake, over to you. Thank you.
All right. Thank you, Chairperson. Good morning to the honorable members of the committee, and morning, Deputy Minister, and morning, DG and colleagues. My name is Blake Mosley Lifatula. I'm the DDG for Public Sector Monitoring and Capacity Development. Can the Secretariat please present the presentation so that I can proceed? This presentation is going to be a report on the journey that we have followed as South Africans in responding to the coronavirus pandemic that is currently afflicting our country. It is based on what has actually happened up until now, and it will reflect on the activities that have taken place in the pre-disaster phase and in the first 2 weeks of when the disaster was actually declared. So this report will talk about the activities from March up until the second week in June. As such, a full impact assessment will not be possible given that this is a first quarter report. A full impact assessment of the efforts of government in fighting the COVID-19 pandemic will be covered in the second quarter report, which will be due in 2 to 3 months from now, towards the end of September, end of October. If we can move on to the second slide, please. Just in relation to the second slide, it is important to indicate that when the pandemic actually happened, our country already had particular challenges in relation to a high unemployment rate, huge degrees of poverty and inequality. And when the president actually spoke at the State of the Nation address, a lot of government's attention was going to be directed at addressing those three triple challenges. So when the coronavirus pandemic actually happened, it aggravated the challenges around poverty, unemployment, and inequality. And a lot of the plans that we actually had as government had to be amended to address how are we going to protect the citizens of the country from the COVID-19 pandemic over and above the normal socio-economic development challenges that we actually had. I need to indicate that COVID-19, fighting the COVID-19 pandemic, there is no textbook. All of us in government had to learn as we actually went ahead because it was a new phenomenon. And the advantage that we had was we also managed to learn from countries elsewhere who had experienced this pandemic much earlier than ourselves. That's the only benefit that we had, but otherwise there is no textbook solution to the current pandemic. Next slide, please. Slide number 4. So in terms of, you would see that for the periods of January up to March, a lot of the work that we actually did as government was to mobilize resources, put plans in place as to how we are going to be afflicted by this, of how we are going to fight this particular pandemic. But by the 15th of March, it was quite clear that something drastic actually had to happen, and hence the president actually by the 15th of March actually, declared a national state of disaster. And it was quite clear, if you look at the statistics, it was quite clear that there was a huge increase, in terms of the number of people actually infected. The first infection was detected by the 5th of March, and then it increased quite dramatically, to the 23rd of March by, a huge number. And on the 23rd of March, the president declared a nationwide lockdown, for 21 days, because the essential intention of government strategy then was to ensure that we flatten the curve, firstly, and then secondly, we also buy time to ensure the readiness of health facilities, so that when we actually reach the peak, our facilities are not, the health facilities are not actually going to be overwhelmed. Next slide, please. So slide number 7, please. In terms of our response as the South African government to the COVID pandemic 19, you would see that the strategy, if anyone does a reading of our strategy as South African government or our COVID-19 pandemic strategy, you would see that it is actually anchored on 7 pillars. One deals with public health. The second one deals with social relief, food security, and basic services. The third area relates to fostering national unity. The fourth area relates to support to small businesses, informal sector, and workers. The fifth is business support and stimulus and rescue. The sixth is very critical, which relates to communication and information. And then, of course, the international aspect. So all these pillars would have different objectives as to what is to be achieved. And what this report is about, it's about how government has actually, the responses of government with respect to these 7 pillars, the actual activities that we actually undertook, and what are the preliminary lessons that we can actually learn from the work that government has actually undertaken for the given that the report is written up to the second week or the last week in June, we are talking about work done in about slightly less than 3 months or 2.5 months, at the most. Next slide, please. Following the response, slide number 8. Following the Can we get to slide number 8, please? Following the response from government's initial strategy to fight the COVID pandemic, it was quite clear that we had to mobilize society as a whole. And there was a whole lot of consultations that was actually undertaken by the president and the cabinet to get society behind the efforts of government to fight this pandemic and to get the society behind society behind the strategy of government to fight this particular pandemic and to get society's buy-in and cooperation, to the extent that the World Health Organization also contributed. The World Health Organization also efforts of the South African government led by the president in mobilizing society and getting society's buy-in and having a listening ear to what citizens in the country are actually saying, and that is essentially what slide number 9. If you can go to slide number 10, please. Secretariat, slide number 10. So how did we then respond to this pandemic? Not only did we release a strategy as government, but government also mobilized its institutional, infrastructure and set up institutional mechanisms, to deal with this particular pandemic. The first established was the National COVID-19 Command Council, the NCCC, which was actually chaired by the president and consisted of members and experts, from the scientific community, and this provided overall strategic direction, and which would make recommendations to cabinet, for adoption, amendment, and/or rejection. Now, it is important to note that the NCCC was actually replicated also at the provincial level and at a local level, a provincial government level and at the local government level. At the provincial government level, we've got the provincial disaster command, centers, and at the local government level, it would be coordinated at the district, district national, district coronavirus command center, and all those respective institutions at the provincial level and at the local government level would mirror the activities of the NCC at the national level, and they would also have their own work program and responsibilities, cut out. It is important to indicate that visible leadership has actually been given to the nation in the form of the president and followed by the ministers, the respective ministers actually affected. And President Ramaphosa has been very, very visible in terms of giving feedback, interacting with the nation at intermittent times. The particular strategy of government has been essentially to flatten the curve and to buy time to ensure that the health facilities and the pandemic, the health facilities, can actually deal and manage the peak of this particular pandemic. It is important to indicate that in terms of the technical structures, there's a technical structure that is supporting the NCC, which is the National Joints, or the NET Joints, which is chaired by the Secretary of Defense. And the net joints would also have different work streams that deal with particular issues. Just to give an example, some of the work streams would relate to the public health, infections and containment work stream, and it would have two subcommittees which relates to the decontamination of public spaces and facility management, in other words, the setting up of field or, hospitals, etc. Then there's a work stream on travel restrictions, border security measures. There would be a work stream on the legal and regulatory measures that would deal with when disaster regulations are issued and when disaster regulations are actually updated. There would be a work stream that deals with the economic measures, a work stream that deals with the social impact and mediation measures, and then also critically the work stream that deals on data and modeling, which essentially informs the projections and the advices that the medical advisory committee would actually make and the scientists would actually give to government. And then there's a work stream on enforcement and security. It is also important just to indicate that another critical coordinating structure that has actually been set up and that has been dealing with the pandemic relates to the President's coordinating, council, which includes the President, it includes the premiers of the different provinces, and also representatives, the mayors, as representatives, from local government. I think it is important also to indicate that as part and parcel of mobilizing society's effort, behind the fight, behind fighting this particular pandemic, the President has been leading the charge in terms of consultations with other organs of civil society, which would be business, your traditional leaders, and various other stakeholders in terms of hearing what their views actually are, strategizing, getting input from them in terms of putting strategies together, and in crafting, communicating messages to the broader public as such. So the President has been the visible face in terms of fighting this particular pandemic. Next slide, please. I think it is, we also need to note the role of the media here, that the South African government established a partnership with the media, and all of us have at times been glued, to the media, listening to the updates, that the President would actually give. There's quite a number of updates that the President gave, about 5 or 6, I think. And then those updates that the President would give would actually be followed up by various briefing sessions of the ministers affected, and who would be speaking on additional, and would be speaking and elaborating on the regulations affecting their particular sectors, be it the economy, be it tourism, be it housing, be it education, etc. So the the political leadership in the form of the cabinet has been fairly visible to the public in terms of communicating to the citizens of the country, and the key messages around wearing a mask or a cloth, social distancing, and washing of hands intermittently, during the day and in the evening, has been hit home quite with a huge amount of regularity. And we also need to indicate that other media, both print and electronic media, have also contributed in terms of distributing the message, of government of wearing a mask, social distancing, and washing of hands. And our colleagues in communications informs us that over 200 interviews with different media houses have actually been done, by our leaders in the form of the president, together with the different ministers. And the South African government, we're also collaborating with social media, to deal with fake news, because it's important that fake news is actually dealt with ASAP, so that it does not show, sow any, confusion to the citizens, of the country. Next slide, please. So in relation to, feedback and communication, I must indicate that the performance of our political leadership has been quite, extraordinary. We have also, through the leadership and the advice given by the Medical Advisory Council and the NCCC, strategies to put in place to address the issue of flattening, the curve related to mass screening. The president made the announcement on the 31st of March around a massive community screening campaign, which would actually be implemented. We have trained community health workers, and they basically started their work on the 3rd of April. On the 3rd of April, and the screening started on the 8th of, April. And also the health sector also intensified its own screening, testing, and identification of contacts, contact tracing, etc. With respect to the lockdown, it is important, as we all know, that the Department of Basic Education actually issued a circular to schools to close on the 18th of March and to reopen on the 14th of April. And we all know, the challenges with regard to how we as a country have tried to deal with the impact of the coronavirus at the schooling level, and in fact also at the other educational institutions such as universities and tertiary and other tertiary institutions. So during the lockdown, all post-school education and training institutions, universities, TVET colleges and community colleges were closed. We all know what the regulations related to around, mass gatherings. Those were actually banned. All workplaces were actually closed, except for those, essential services. In other words, the economy was actually shut down. Except for the essential services. Movement was actually curtailed during level 5. The challenge that we have around the homeless people prior to this coronavirus, that challenge was actually addressed by the relevant authorities at the municipal level by providing shelters for the homeless and feeding, and also providing food for the homeless. Visits to institutions such as hospitals, as an example, the prisons also were curtailed. And then, of course, not only was national travel actually banned for that particular period, intra-provincial travel was actually not permitted. The borders were also closed for international travel, etc. So those were the features, of just a brief summary of the features of the lockdown. When the lockdown was actually declared. Next slide, please. This is just a graphic description of what I was actually talking to in the previous slide. Next slide, please. I think it is important to indicate that between the 1st of March to the 23rd, of March, there's been an average increase of cases by close to 42.7%, and that was actually before the lockdown. Now, when lockdown was actually instituted, that reduced, to about 4.4%. So one can actually see the impact that the lockdown actually had. If it is that this particular action, has not been taken, we could have lost actually much more lives than what we actually currently, have lost. So the lockdown basically achieved, the purpose of number one, trying to curtail the spread of the virus, trying to reduce, loss of lives, and also buying time to ensure that the medical facilities have sufficient time to upscale its capacity. Next slide, please. This is just a slide that basically indicates how we can compare, to the United Kingdom. Next slide, please. This is also a slide that indicates our comparison in relation to other advanced, and least advanced, countries. Next slide, please. I think coming to the impact of the lockdown, all of us are also know that the lockdown has had a devastating impact on lives and livelihoods. Firstly, in relation to food security, even before the lockdown, we had challenges around people who are actually food insecure. Post the lockdown period, more people have actually been added to that pool who are actually food insecure. It is also common knowledge that when the schools were actually closed, those kids that actually had access to the school nutrition program, were disadvantaged, by the fact that schools were actually, closed. It's also, when you speak to people in the local government sphere, they'll indicate to you that the impact of the lockdown on local government is fairly severe, in the sense that municipal revenue collection has actually been placed under severe strain. And SALGA conservatively estimates a 5% drop in payment of municipal rates. And this would actually amount to an estimated total amount of about 14 billion, in lost revenue. I think an important point also to be made is that the lockdown, because of the restrictions, because of the fact that there were no sales, of alcohol, resulted in ensuring that there are less alcohol-related crimes, and also resulted in ensuring that the trauma cases, at the hospitals and and clinics were substantially reduced. Next slide, please. In terms of the impact that the lockdown has had on the economy has been fairly devastating. Economic activity reduced substantially in April. Manufacturing almost came to a standstill. The South African Reserve Bank estimates, that our economy for this financial year will contract by 7%. National Treasury is a bit more pessimistic and indicates by 7.2%. A state survey that was done earlier indicated that about 36% of firms indicated that they would be laying off staff. Most of the sectors that have been hard hit, relates to those in the trade, catering, accommodation, construction, manufacturing, finance, and business services. It is estimated that conservatively between 690,000 to 1.8 million job losses in the National Treasury. If you look at newspaper reports, other newspaper reports talk about close to 3 million jobs that have actually been lost. And it is also indicated that the bulk of the people actually affected relates, are women and those aged between 15 to 25-year-olds, and they are concentrated in the most, in some of the hardest hit, sectors. And so it's common knowledge that during the lockdown, many of our people actually experienced loss of income in some form, or the other. So what COVID has done is that it has actually exposed the fault lines in our society. It has exposed more people, to hunger and food insecurity, and it has also increased, people's vulnerabilities. Next slide, please. So what was our response as government? Through the leadership of the president, the first phase of announcements that he actually made on economic measures to mitigate the impact of the COVID-19 on the economy was related to the Solidarity Fund, firstly. Secondly, it also related to the temporary employee relief scheme, which was introduced, essentially to support, workers by providing wage support. There was also the employment tax incentive program that was introduced. There was also a tourism relief fund that was produced. And then on the 21st of, there was also an industrial funding package of 3 billion, which was established by the IDC, which actually had to assist the vulnerable firms and to fast track financing, for companies. And then on the 21st of April, the president also announced the second phase of response to the COVID pandemic. And this is where the president actually spoke about the 500 billion stimulus package, which amounts to 10% of the South Africa's of our GDP. It's a very big. It's a very big, stimulus package that has actually been announced by the president. Next slide, please. In relation to agriculture, environment, land reform, and rural development, there were also specific interventions which were actually made. Which basically related to providing support to farmers to ensure that planting, harvesting, and other services to agricultural activities, were not disrupted. The Land Bank was given an additional 100 million to assist farmers under financial distress. The Fisheries, Forestry, and Environment Ministry. All fishing sectors were actually granted a 90-day exemption from having to reapply for new or existing permits. Sports, arts, and culture, you would see that there was 150 million rand relief fund to assist artists, athletes, and technical personnel to minimize, the impact of the lockdown on this, particular sector. So you would see that government's attempt has actually been multi-sectoral and trying to deal with the impact of the pandemic on the different sectors. Next slide, please. Next slide.
If I just let you continue while he's still to project the next slide. Just continue, okay, because you are going through the line by line. Because you are left with only 7 minutes.
All right, okay, then I'll try and speed up the presentation, Chair. So you'd also see that through the Department of Public Works and Infrastructure, the additional properties were actually set aside to be used as isolation and quarantine facilities. all the other different, departments of minerals and energy, transport, all of them have actually made sure that they have regulations that are in place to deal with the impact of COVID-19 on their particular on their particular sectors. I'm just trying to navigate to the last couple of slides, given the 7 minutes that I actually have, Chairperson. You would see there was also a response. Our response as government also related to security and international relations, as we indicated that government continued, to collaborate with the World Health Organization. International travel has actually been, restricted. Government also focused particularly as to how it can improve, its performance within, security and fighting crime within the country. Social grant payouts dates in March was also staggered. March and April were actually staggered in order to deal with the issue of social, distancing. I've indicated that people who were actually homeless were provided with actual shelter. And you would see that slide number 24 basically talks about just visual depictions of society, during level 4 and during level 4. It's important also to note that the strategy of government has been fairly dynamic. The strategy of government to respond to the COVID-19 pandemic has been fairly dynamic and was also guided by the risk-adjusted strategy that government adopted, early in May, where there were actually 5 levels, and all of us know what those levels actually are. And all of us are now actually aware that we're now on level 2. Slide 26 just basically indicates the performance of government in relation to number of people screened. You would see it's 15 million as it stands as at the second end of June. And you would see the test actually conducted as at the end of June was close to 1 million. And you would see the cumulative number of COVID positive cases, 52,991 as at the end of June. This information is slightly dated. If you look at the information of today, you would see, what the actual, stats, the actual statistics are. The importance of slide number 27 is that it indicates that even if though we are ranked at of country that has got the highest number of infections, the most important thing and the message that should not be lost is that our recovery rate is very, very good. When I looked at the stats this morning, our recovery rate is at about slightly more than 80%. And in terms of this slide, our recovery rate is at 73.4, which is very, very high. And then also, I also need to indicate that our mortality rate also is very, very low. And you would see that in terms of this slide, it stands at about 9,000. And if you look at the stats as of this morning, we would be at about 11,900, somewhere around there. So in terms of recovery, and we're doing okay as a country, and that's putting it diplomatically. And in terms of deaths, our death rate also is not